Well, hey guys, in today's video, I want to talk about acne in your 40s. As you all know, I recently went to the American Academy of Dermatology meeting in New Orleans. I attended a lot of lectures, and one of them was related to acne in adults, and it got me thinking, I know a lot of you all struggle with this, and it's time for an update. In this video, I'm going to explain to you why acne happens in your adult years, why you get it for the first time, or why you're still dealing with it. I think understanding why things happen is really empowering. I hear so often people say, doctors, dermatologists, they don't get to the root cause of issues. All they do is prescribe medications. But we really do get to the root cause of why certain things happen, and our medications that we use to treat these things do address the root cause. So acne is a skin condition where there are a lot of different factors playing a role that all culminate in the root cause. First of all, you have a problem with the skin cells lining the pore. They don't differentiate appropriately. They get very sticky and clog up the pore. Another problem is you have a lot of sebum being produced from the oil gland that is associated with it. And as that sebum is being produced, there's a little bacteria that lives down in the pore called Cutibacterium acnes. He feeds off of that sebum and breaks it down into inflammatory compounds that bring in a lot of inflammation and lead to painful breakouts. When we're talking about sebum production in the sebaceous oil gland and its role in acne, it's heavily influenced by our hormones. This is one of the main reasons why people can continue to experience acne into their adult years, especially women, and especially around the time leading up to menopause and with menopause. Menopause is presented to women, I think, as a sort of vague concept, but it's defined as a point at which 12 months have elapsed after a woman's last period. But the years leading up to menopause are referred to as perimenopause, and you can have a lot of different symptoms related to changes in hormones leading up to menopause. Things like hot flashes, night sweats, irregular periods, mood changes, and acne. I titled this video Acne in Your 40s because acne can really crop up during this time. For women, menopause usually happens in your 50s, but perimenopause usually starts around age 45. Of course, the age at which this happens varies from person to person, and the duration of perimenopause and perimenopausal symptoms will vary a lot from person to person. Some people can deal with perimenopausal symptoms for 14 years. When it comes to acne in adult women, hormonal factors are a major driving component. The reason for this is that with menopausal changes, you have a decline in the estrogen hormones and a subsequent increase in the androgen hormones. Those are the male hormones, but both men and women have androgen hormones. It's those androgen hormones that drive oil production from the sebaceous oil gland. You see, those androgen hormones stimulate sebocytes, which are the cells that make up the oil gland, to proliferate and to make more sebum. And then Cutibacterium acnes down there in the pore goes to town, snacking on that, generating a lot of inflammatory mediators known as lipases. The changes in hormones with perimenopause and menopause also affect the scalp hairs. You have a decrease in hair growth rate, you have a decrease in the growing phase of the hair cycle, and you also have a shift from terminal hairs, which are the hairs that you see on your head, to fine vellus baby hairs. They miniaturize. And that is part and parcel of what is referred to as androgenetic alopecia. Androgenetic because there, of course, is a genetic tendency towards developing this, but it is obviously also influenced by those androgen hormones. You might ask yourself, why is it that with perimenopause and menopause, we start losing more hair on our head, but it seems to grow everywhere else? Yes, this is the great paradox of hair loss and hair growth. For whatever reason, the scalp hairs respond to changes in hormones differently in comparison to the hair follicles on the rest of your body. You see, the androgen hormones, you have testosterone. Testosterone gets converted to something called dihydrotestosterone through an enzyme known as 5-alpha reductase. That dihydrotestosterone has greater affinity for the androgen receptor. That potent form is actually what is influencing the sebaceous oil gland, leading to acne, and it's also what is influencing your hair cycle on your scalp. And it also, oddly enough, leads to increase in terminal hair growth in a male pattern. Hirsutism is hair growth in a male pattern. The upper lip, sides of the face, the areola, the upper thighs, and the abdomen. So skin and hair changes that can happen in perimenopause and menopause not only include acne, but also hair loss and hirsutism. Now, not everyone going through perimenopause and menopause develops these. These changes that women can experience with perimenopause and menopause in terms of acne, hair loss, and hirsutism, these are referred to as androgen-mediated cutaneous disorders. So is it just part of normal aging for some people? It absolutely is part of normal aging for many women to develop these types of skin and hair side effects. However, one thing you will hear over and over again from many women who are in perimenopause and menopause is that they really don't feel as though they're being taken seriously by their healthcare team, by their doctors. You know, they have a lot of concerns about the things that they're feeling, the things that they're going through, and they don't always feel as though their concerns are being addressed, acknowledged, often feel as though they're just being brushed off. Oh, this is just normal aging, bye. And in some cases, having these androgen-mediated cutaneous disorders, that's a mouthful, things like acne, hirsutism, and female pattern hair loss or androgenic alopecia, it's not always just related to normal aging. You definitely need to take these things seriously. Women who have these concerns, they should at the very least get a very good history and physical exam. A woman coming to their dermatologist in perimenopause or menopause saying, hey, I've got acne all of a sudden and I've never had it before. My acne I've had my whole life. Why is it not going away? It actually seems to be getting worse. Right there, a very good history and physical exam are warranted. Yes, it could be normal age-related, acne as it relates to the hormonal changes around menopause, but it also could be associated with some other things that necessitate more of a workup. So your doctor taking a really good history is very important. Things that they're going to want to be asking you are like, let's talk about the history of your periods throughout your life. And that may seem odd to be talking to your dermatologist about your periods, but it really does matter. Have you ever conceived or tried to conceive? Did you have difficulty conceiving? Have you ever been pregnant? Other things that are important to know are, what is your family history? Do the women in your family, did they struggle with heavy periods, irregular periods? Do they struggle to get pregnant? Those are important questions that the doctor should be asking you. The other thing I would ask them is, as a side note, do you do any sort of facial hair removal or body hair removal? And that might seem like an odd question, but if you think about it, a lot of people remove facial and body hair. They're coming in with a concern for acne, and they may not realize, hey, I also have a lot of hair growth. But that's something that should be elicited in the questioning, because if you have a lot of new onset hair growth, say on your upper lip, and a male pattern hirsutism, but you're not presenting that way because you've removed it, that's an important piece of the history to get out. A physical exam is very important, not only focusing on the acne, but the patient overall. Where is the acne located? Is it on the face only, or is it face, chest, and back? Buttocks, those are important because that's going to influence what types of treatments might be offered for the acne. But importantly, are there other skin and hair signs that might suggest a more involved process beyond normal age-related changes and acne triggered by hormonal changes as they relate to menopause? For example, what does the hair look like? Is there evidence of miniaturization of those hair follicles on a scalp exam? Are there any other physical exam findings that suggest underlying hormonal disorders that would overlap with hyperandrogenism? For example, is there acanthosis nigricans that might suggest insulin resistance and support more of a diagnosis of PCOS? Or is there obesity? Because there are some other underlying problems that can present very similarly. For example, you can have what's called iatrogenic hyperandrogenism. Iatrogenic meaning like you're taking a medication either by mouth or you're injecting it, or a supplement that is influencing your hormones. This can be an anabolic steroid. Maybe you're involved in sport and you're taking some sort of supplement that has anabolic steroids in it that can lead to many of these androgen-dependent cutaneous disorders. Or maybe you are taking testosterone. Some women are prescribed testosterone for some of the symptoms of perimenopause, like low libido, and those can cause iatrogenic hyperandrogenism and impact your skin, lead to acne, and can lead to exacerbation of androgenic alopecia, trigger that for those who have a genetic tendency towards that, and also can lead to hirsutism. Also, certain medications can paint the picture of hyperandrogenism, namely those known in the class of anti-epileptics. Now, these are medications that are used to treat seizures, but they're also often used to treat migraines. For example, the medication valproic acid, otherwise known as Depakote, that's its brand name. Valproic acid can actually cause a PCOS-like picture, and I say like picture in that it's not true PCOS, but rather the medication causing symptoms of PCOS by messing up the hormones. A similar medication, oxycarbazepine, likewise can cause a similar disruption in the hormone levels, leading to these types of things. So, changing the medications around, lowering the dose, working, if you're using these medications to treat migraines, talking to the neurologist about a possible switch. But you also can make it into your 40s and 50s with undiagnosed PCOS. This is not out of the realm of possibility. It's actually probably more common than you would think. A lot of women deal with irregular menstrual cycles and difficult problems with conceiving. A lot of women deal with diabetes, insulin resistance. These are all things related to PCOS, and they may go a while without being properly evaluated, make it into their 40s, and finally get a diagnosis. Again, coming back to the physical exam, some other findings that might suggest PCOS are, like acanthosis nigricans suggests there may be some underlying insulin resistance there that goes hand in hand with PCOS, where you also can have disruption and hyperandrogenism and acne, pattern hair loss, and hirsutism. You also can make it into your 40s with undiagnosed congenital adrenal hyperplasia. This is a disorder of the adrenal gland that can likewise cause hyperandrogenism. Last but not least, you can have a adrenal tumor or an ovarian tumor that secretes androgens. That is a possibility. So that is not just normal aging. This is why seeing your doctor, talking to them, getting a doctor that you feel comfortable with, that you feel as though you're being heard, this goes a long way. This is why your doctor-patient relationship is key. If you don't have a good doctor-patient relationship now, try and find one, foster it, because during the perimenopause and menopause, you need to have someone who you feel comfortable talking to and you feel as though they are going to listen and hear what you have to say and take your symptoms seriously and not just brush you off as, oh, this is just menopause. Because there are situations where it is more than just menopause, and it's perfectly valid to have concerns, to want to talk about your symptoms, why they're happening. You need somebody who is going to advocate for you and be there when you're going through these things. And there are also a whole other host of symptoms that women deal with during perimenopause and menopause that affect everyone differently. The degree of these symptoms is different for each woman. The duration with which you deal with them is different. How you're going to feel comfortable addressing them is going to differ in terms of treatment options. If you don't have a doctor that has the time to address these things, you need to find another doctor. If you don't feel as though your doctor is taking your symptoms as they relate to menopause seriously, then how are you going to confide in this individual if you develop stomach pain down the road? Are you going to feel apprehensive that they don't have the time to address that? I mean, this should really vet out who is going to be in your best interest. I really would encourage you to approach developing a physician-patient relationship as a relationship where you are both on part of the same team. It's not one of these where I am the doctor, listen to everything I say, it's this, not that, bye. You need to feel confident that the person guiding you through this medical decision making at this key time span in your life has the time for you. If you don't feel like they have the time, if you feel as though they're dismissing you, they're not returning your phone calls, then you really need to find someone else. I know you clicked into this video to hear about adult acne, but I have to emphasize having a good physician relationship. It's going to make a huge difference for you as you get into your 60s, 70s, 80s, and beyond. You really, it's something that you really want to cultivate as early as possible. It's never too late to do so, but as early as possible. And again, if you don't feel like your concerns are being heard, if not now, then when? Why waste any more time with a physician who is just not able to give you the time that you need and deserve? It's a time, like I said, where you're going to be likely making more medical decisions than you have, say, in years prior. If you're someone who is otherwise healthy, getting into your 40s and 50s and experiencing the symptoms that can come with menopause, although again, not everyone goes through the same symptoms, the same severity, but if you're experiencing these things for the first time, it can actually be a very strange place to be because you've been, healthy your whole life. And no, going through perimenopause and menopause is not unhealthy, but to have symptoms that negatively are impacting you, I really feel like a lot of women can almost feel like their symptoms are just all in their head. That's complete nonsense. You really need someone who has a time to listen, explain things, and really listen to you when you feel like things are not right. Because if you've made it this far in life, you've been in the body that you have for over 4 decades. There's a good chance you have some intuition that if you feel as though things are not right in your body, you need someone who's going to take them seriously. And I bring this to your attention in these cases where adult acne is more than adult acne. Yes, it can be a perfectly normal thing, but if you don't feel as though it's right, you're seeing other changes very strongly, new onset, lots of hair, you've got a lot of hair on your body that's new, really bad acne, then yeah, these are not just normal aging. Even if it is normal aging, there are effective treatments out there for acne that work well in adulthood. Many of the same things that we use to treat acne in adolescence, pre-adolescence, are used to treat acne in adults. But with menopause, you also have some other skin changes, right? Your skin becomes drier. It doesn't hold on to water as well. So topical medications for acne, which are drying to begin with, they can be even more drying, even more irritating. So stuff that you can buy over the counter that is FDA approved for acne as an over-the-counter treatment, those things can still work in adult acne. They can still help, and they may, in some cases, be enough for you. Salicylic acid can help exfoliate the pore and can help minimize breakouts. Benzoyl peroxide is anti-inflammatory, targets that Cutibacterium acnes, which is there. And it also is anti-inflammatory. It helps clear and prevent breakouts. And then you also have adapalene, an FDA-approved acne treatment, which can likewise help control the turnover of those sticky skin cells in the pore, further preventing breakouts. But none of these over-the-counter treatments address the hormonal component of acne. So don't be surprised if you may need some other treatments that are prescription only. And I have a lot of videos on this channel about prescription treatments like spironolactone, as well as the newer topical anti-androgen Winlevi. But if you have an underlying endocrinologic disease like PCOS or you have congenital adrenal hyperplasia, there are going to be more specific interventions that will be needed for you. And if you have a tumor in the ovary or the adrenal gland that's pumping out androgens, well, that's going to need treatment. And all the benzoyl peroxide in the world is not going to tackle the acne so long as you have something like that. All right, you guys, that's what I wanted to say in today's video, all about adult acne in your 40s. Now, in this video, I mentioned adapalene and over-the-counter acne treatment, but I get a lot of questions like, hey, to what extent is this helpful for improving the signs of skin aging? Now, on the end slate, I have a video that talks all about that, so watch that one next. But if you like this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.